Well, thank you all very much indeed for bearing with me. It's a reckless man who stands between a hungry mob and their lunch, so I shall go through at a reasonable lick for you. My name is Hugh Davis from the University of St Andrews, and I'm really speaking on behalf of a much wider group of people who are involved in this project from its inception. And it's about, as Charlie says, it's about transformative innovation in the health and social care sector. It's about trying to do things that are radically different, and I'll explain as I go through what I mean by some of these ideas of radical transformative innovation. So let me just say a little bit about health and social care. You don't have to look too far across the media or to know too much about health and social care services to know that there is a crisis. It's not a nascent crisis, there is an actual crisis in health and social care, driven partly by the fact that inflation in the health and social care system is running at between 3 and 4%. At the same time, driven by demographic changes, an aging population, technological change and so forth, at the same time as we've got essentially flatlining budgets and a real lack of political will to address the shortfalls in funding, and a political body that seems to be completely and utterly distracted by Brexit and is likely to be distracted for a considerable time to come. And one statistic I learnt just over this weekend is that about 7% of the NHS workforce in Scotland, it comes from other parts of the European Union. So if we were to lose 7% of our workforce, it's an intriguing possibility to think how we would manage. Nonetheless, what we are trying to do in this group, and have been doing over a number of different workshops, is trying to weave together different strands of thinking that are out there already to try to make sense of what possible futures might look like for a health and social care system that wasn't in perpetual crisis. And the different strands of ideas and bodies of academic work and writing and so on that we wanted to try to pull together are these four here. So first of all, we wanted to think about what is truly transformative innovation. What might it look like to do things that were not just about tinkering with the existing system for all the good that is worthwhile pursuing, but what would it mean to have something that was truly different, a rupture, a break from the past? Can we incorporate into that thinking some ideas about new types of public health? And I'll say a little bit more about each of these shortly. New thinking in public health that goes beyond looking at individual health and social care needs to thinking about how individuals are embedded in context and what's the new thinking that can help us to understand a more holistic, a more integrated view of human health and human flourishing. And this is about bringing into the health and social care system the ideas around person-centered care, what it means to treat somebody holistically, compassionately, humanely, and not just as an item to be processed using whatever technologies are at your fingertips. And lastly, when we're looking at the ways in which we deliver health and social care, what kind of organizations we have, can we shift the conversation to talk more about the cultures in those organizations and less about the structures, the processes of organizing, the values, beliefs, assumptions, and patterns of practice that sit in healthcare organizations rather than the structures within which they're embedded. So what we've been trying to do through a series of evolving conversations is to try to think about new integrities, if you like, new patterns of resources and relationships that come together around which the system is configured that delivers better outcomes than we currently manage. So what do I mean by integrities, patternings for the future? There are already many integrities in the health and social care system. They're built around ideas, for example, of hospitals, or of healthcare centres, or of residential nursing care. They're also built around the ideas of the professions, the way in which we segment our different patterns of expertise into different professions and how those professions compete and, yes, sometimes collaborate. It's the configuration, the patterns of resources and relationships that have a degree of stability and endurance in our system, and it's also the pattern of values, beliefs, and assumptions that underpin the way in which those configurations work. And what we were interested in doing in being truly disruptive was looking beyond how we can incrementally move from what we've currently got to what would it look like 15 or 20 years down the line if we took seriously some of the possibilities as outlined on the slide here to think about incorporating new ideas of public health, patient-centered care, and so on. So how did we set about doing this? It was essentially interactional and dialogical. It was bringing together a group of people over a series of 3 different workshops to not just examine the existing patterns of service delivery and what's wrong with those and the kind of the general dilemmas and crises and concerns that people have, but to lift our heads up and think about new ways of envisioning the future. And there's an old saying that says, you know, when you're up to your neck in alligators, it's really hard to remember that your plan was to drain the swamp. And I think for a lot of people who work in health and social care, it's very, very hard to think about what was the original vision of what we're trying to do here with these public services. So we came together over 3 different workshops with a good degree of continuity across those workshops to try to think about what these integrities might look like in the future. To not just describe those integrities, but also to try to feel them, to try and play through, for example, role play. What would it be like to operate and to work in those integrities in the future? And what would they be built around? So the ideas we were building on here were ideas that come from the International Futures Forum, work that Graham's written about at some length, and Bill Sharp and others, about trying to innovate in a way that is truly disruptive, that truly does transform. And one of the models we've used in this is what's sometimes termed the 3 horizons model of innovation, which differentiates between different kinds of systems that are operating to some extent in parallel. So if I briefly talk about these, the y-axis here is one of prevalence. How common are these patterns of operating, these configurations of resources and relationships that allow us to get things done? And the current way of doing things, the business as usual, is Horizon 1 stuff, where, of course, we innovate and we develop and so on, and we deploy our capacities to get things done. That's business as usual. But over time, of course, those ways of behaving, those ways of practicing become less effective. The dysfunctions that are built into the system, the unintended consequences, the overhead of getting things done. And they are going to trail off. They're going to drift away and become less useful over time. And how that slope of that red dotted line, whether it goes down precipitously or whether it drifts off very slowly, whether it's enduring, that is to some extent a function of how we respond to the potentials or the dysfunctions of Horizon 1 type thinking. But then what comes up is Horizon 2 stuff, innovation, if you like, incremental innovation. So new ways of thinking about things, some of these innovations in Horizon 2 get deployed to try and keep Horizon 1 thinking afloat a bit longer. You know, we keep doing things in the system, within the system, that just allow us to keep moving things forward. But much more interesting to us is this idea of Horizon 3 thinking. The world will be different in 30 years' time. What will it look like? We don't yet know. We haven't yet got the vision to see what it will look like. There are some pockets of that future already here in the present. Can we find them? Can we amplify them? Can we find ways to talk about them in a way that we might change the trajectories here to pull closer to us some of these creative integrities that we might think about? So this is a way of thinking about different types of innovation that tries to move us out of thinking just about how we can incrementally change things to think about how we can deploy more disruptive modes of thinking, how we can envision new ways of being in the future. The second set of ideas is a whole bunch of ideas around the 5th wave of public health. So we know, for example, going back into the 19th century, that structural changes, including things like hygiene improvements, clean water, and so on, they were built up without any clear understanding of the science behind disease transmission, but we knew we got benefits from them. We then move into a sort of biomedical view that's led us to discover much about the pathophysiology of disease and to find effective ways of treating it. We built on that to understand lifestyle-related conditions, cardiovascular disease, lung disease, asthma, and so on, and the lifestyle issues that underpin that, and we can offer advice and guidance to try and help people improve their circumstances. 4th wave is really all about understanding the social determinants of health and recognizing that health for individuals is embedded in an effective welfare state, is embedded in an effective and functioning society. And the fifth wave of public health is about emphasizing not just pathologies, but about health, the actual promotion of health, human flourishing, recognizing that human flourishing is very contextually embedded, recognizing that people's health outcomes are emergent outcomes of complex adaptive systems, and that we need to think about some of that literature much more clearly if we're going to try to tackle the pathologies that are so prevalent in our society. So there's a bunch of ideas there that lots of different people are thinking about that often don't come into contact with organizational scholars. It sits in a different set of the literature. And then thirdly, this notion of patient-centeredness, and moving away from the idea that a person is just a problem to be diagnosed and fixed, to the idea that a person has needs and aspirations and capabilities that they need to be facilitated to flourish. So it's about humanizing healthcare, building in compassion into our services, and delivering care in a way that is much more sensitive to the person who's receiving that care, and moving away from service delivery that's based upon professional boundaries and professional needs. And our hospitals are absolutely designed to service professionals, not to service patients. And lastly, there's a whole set of ideas from the organizational literature that says if we keep viewing organizations as though they were machines, as though they were sort of mechanistic arrangements for getting things done with hierarchies and command and control structures, we miss what is essentially human about human organizations, which is that they are social and cultural places that are full of values and full of meaning and imagination and emotion. And we need to think much more about our healthcare organizations in these kinds of terms. And indeed, at the same time, moving away from talking about organizations as things, as nouns, to thinking about organizing as a process, as a verb, through which outcomes are delivered. So the process, what we did here then was to try to think about what these creative integrities might look like. We brought people together, we got them to think about the future, to not just think about what was wrong with the existing state of affairs, but to think about how would you rebuild new sets of relationships, new ways of delivering care that took seriously some of the possibilities embedded in the literatures that I've been speaking about. And I've got a video here, I think, that Nicola's going to play for you, which is about 6 minutes long, I think, that allows some of the other participants' voices in this process to be heard and to give you a flavor of the sorts of discussions that we were having over the 3 workshops that we ran.
I was inspired by the time I had in Aberdour, especially with this view on the way I had each morning. But the inspiration really came from being part of a group of people that had a shared concern for the unsustainability of the way we're operating. And it also provided permission to think and acquire some skills to act outside the square.
This was a program designed to investigate transformative innovation in health and social care. And in saying that, we make a distinction between day-to-day innovation and improvement that is, of course, needed constantly just to maintain the effectiveness of existing systems, and a different kind of innovation that shifts the whole pattern of activity to a new paradigm, a new pattern that is likely to be more viable in the changing world of the future.
One of the many things that I appreciate about the workshop was the way it introduced me to the concept of a creative integrity, not just giving me another useful label, but allowing me to experience the powerful, energizing and transformative effect of participating in a team with shared vision and shared values.
I took the part of the chair of a community benefit organisation, so this was going to be a new creative integrity. But what was striking to me was the way in which much of what we were doing was very familiar. I chaired a meeting and got updates from the members of the board in just the same way as we hear from day to day in my usual work. But what I was hearing back about were very interesting activities, things that were music to my ears. So there was an extensive use of technology in really enabling ways, helping people communicate, tell each other about what they were doing, telling each other about the place they were living in, its history, its story. There was work around the green space and making it a positive place for health and well-being to be grown in all kinds of ways. Relationship building and producing new value in the community, and a quality mark to ensure that we weren't doing this in any kind of cheap quack type ways. We were doing it with sound, robust quality threading through what we were doing.
More fresh insight for me from this work was the need to innovate not only projects but patterns. It's patterns of activity that maintain themselves over time, that become self-reinforcing and that grow. And it struck us that normally we're talking about innovating a project, and what we really need to do is to innovate a pattern, a series of projects that reinforce each other and provide for each other the enabling conditions for each to succeed. So by the end, we had 3 different institutions in our vision of the future system, one representing the governance of the system, one representing the users, and one representing the providers. And that seems to be a stable pattern.
And this idea of local care exchanges, where essentially people can barter for care inputs, can focus on what different elements of the community might need and how best they can be provided.
So in our exercise, I became the partnerships manager of the local care exchange, and our idea here was to move away from traditional provider models and really help to involve everybody in the community who could help to support people in their care and well-being. And my role as partnerships manager would be to work with all of those formal and informal local organisations who could play a role, making sure that they would have a personal contact at the care exchange, that the partnerships manager would be in touch with them on a regular basis to let them know what's happening, and really looking for the opportunities for synergy, working together, and not just what they could provide to the care exchange, but where the range of volunteers and people involved at the care exchange could also feed into their work. So it was really interesting to think about how that would work and how it could really work to provide, an organisation like that could provide the glue, a bit of informal infrastructure which would really help to unlock the potential of individuals and communities to live well.
In the third horizon that we envisioned, I played the role of knowledge ninja. I perhaps now prefer the term learning ninja in one of the Live Well centres. That involved me observing, listening, and sometimes more formally researching how things were going for the people who were visiting and working within our centre. It also involved me connecting with other Live Well centres and contributing to and drawing on the broader body of knowledge about how to enable people to live well.
The first was the idea of knowledge ninjas, and in my daily work I guess I fall into the category of being a knowledge ninja, but I think what was very exciting about this workshop discussion around this was the idea that knowledge ninjas are core to how people work on a day-to-day basis, that knowledge is not just something that is imported, that we have to get into practice, that we have to broker in some way, but that knowledge ninjas are people who really know how to infiltrate the system.
I think for me, thinking about my work going forward and thinking about innovation and transformation, the promise of some of the big fixes, the digital health agenda, in particular, because that's something that my work is concerned with. I think we need to think more carefully about trying to stick something into an existing system or introduce the interventions in something that can't support it. And I think we really need to think carefully about how resources are allocated and what we consider to be resources, not just financial, but the kind of mechanisms in place for supporting change, and how we do that together. transformative innovation in health and social care that I would like to see, and I think that that's what we were sort of making some headway towards thinking about and conceptualizing, was that it's about culture, it's about creativity, and it needs to be about collaboration.
So I wanted to show that because we wanted to share with you some of the experiences that people had in the workshops as we enabled them and gave them permission in some ways to think about the world, what the world might look like in the future. So the last couple of things I'll say is this. If we've learnt nothing else about understanding about how we organise and deliver health and social care, and if we've learnt nothing else about the role of top-down reform of the health and care social system, is that it doesn't deliver what it's meant to deliver, that the top-down reform gets in the way of rather than enabling far more often. A colleague of mine wrote a paper once, and it was called Why Structural Change is Futile. And he told me that they thought long and hard about what the final word of that paper title ought to be, and finally futile was the only word that really captured it. And yet if we were going to try and reform our health and social care systems, it has been described, the task has been likened to that of trying to rebuild an aircraft while remaining in stable flight. And that is a huge problem for 24/7 public services like health and social care. And our view is that we have to get much more adept at looking into the future, finding the future, and enabling the processes by which people can find their own way to local solutions that will begin to stick, that will start small scale and gradually snowball and accumulate. And so, of course, we need to think about the first horizon, and we need to think about the second horizon in terms of incremental changes. But if we lose sight of the third horizon and what's possible in the third horizon, then we will miss the possibilities for really transformative change. Thank you.